Alright, welcome to the Fundamentals of Behavioral Science. For our first chapter, we will go over street lingo. Street lingo is a very important topic for board examinations because it ties in behavioral science with epidemiology of sexually transmitted infections. Before we move on, let's review some basic heterosexual sex physiology. Here's an MRI of a man and woman engaging in coitus. Here's the penis, and you can clearly see penetration through the woman's vagina. For our first topic in street lingo, we will go over Netflix and chill. One key thing to note is that Netflix and chill is not limited to heterosexual partners. I repeat, Netflix and chill is not limited to heterosexual partners. Board examiners love to test this fact. So what is Netflix and chill? It's a benign condition involving video entertainment, typically popular TV shows or films. It's usually idiopathic and the third most common cause of coitus in young adults. One high-yield point to make is that Netflix and chill alone has not been shown to increase the risk of sexually transmitted infections. No increased risk. However, this changes with the addition of alcohol consumption. Now is a perfect time to tie in details from our lecture on college student activities. Recall that ethanol consumption leads to increased regrettable decision-making. The underlying mechanism is still being debated, but for the purposes of your board examinations, I think I can explain this concept fairly easily. Now, let's go to the whiteboard and we can better understand the concepts to recreate what consequences occur in the pathway. So, I'm drawing the frontal cortex where decision making will occur, and decisions can either be good or regrettable. Ethanol acts as a good decision antagonist, thus shunting this pathway to increasing regret. Remember that some regrettable decisions in med school include 1. Going to pathology lecture, 2. Hooking up with your anatomy partner, or in the case of N&C, unprotected sex. Clinically, N&C often involves a history of single invitations, super high yield, single invitations to a romantic partner to chill. This must be differentiated from platonic movie watching syndrome. Patients often invite only one person in order to build intimacy. So board exams will present a question that involves watching Game of Thrones at the patient apartment. But don't confuse this with platonic movie watching syndrome, which again from our lecture on friendship presents with multiple friends watching a movie. By the way, do you recall the pathognomonic sign for N&C? This is very high yield, shows up on exams all the time, used in the clinic when you need to confirm a suspicion of N&C. You'll use this in the clinic and you'll need to know this for exams as well. This is a positive Olsen sign. Recall that a positive Olsen sign in patients is defined as side-by-side movie watching with less than 3 centimeters between the patient and his or her partner. So, if here's your patient and here's your partner, if the distance between them is less than 3 centimeters, you have a positive Olsen sign. If you have a positive Olsen sign, make sure N&C with STIs is on your differential. Again, super high yield. Less than 3 centimeters between the patient and his or her partner. Another way board examinations try to test students is by giving a vignette that also involves chilling late at night. Examiners try to get you to knee-jerk respond, thinking that vague idiopathic chilling after 12 a.m. is a booty call. N&C is not limited to any specific time in the day. There are many different definitions of chilling, which are too detailed for the purposes of the boards, but if you see a positive Olsen sign, choose N&C over booty call. Treatment for N&C is bilateral orchidectomy or oophorectomy in an attempt to reduce sexual desire. Again, recall that male and female androgens will increase sexual desire. So remember, if you see on your exam a patient who presents with a recent history of only one single person over to watch Netflix, think Netflix and chill. And if alcohol consumption is involved, make sure you think of Netflix-associated STIs. Let's refresh. What's the most common bacterial STI in the US? Recall from Pathoma that this is chlamydia. This topic is traditionally a difficult one for students, but go over the notes a few times and try to understand the physiology. And that's all we have for this topic of street lingo.